focus on what matters.
Hello and welcome to an Axios virtual event, Building a Climate Resilient Healthcare System. I'm Sam Baker, Senior Editor at Axios, coming to you today from Washington, D.C. I'd like to welcome our audiences on Facebook, YouTube, Twitter, LinkedIn, and Axios.com. And I'd like to invite you to join the conversation today on Twitter with @Axios and hashtag Axios Events. Over the next 30 minutes, I will be joined by my colleague Tina Reed to discuss how the healthcare system is taking environmental impacts into consideration through both policy and infrastructure, and how that system can become more sustainable. Our first guest is the president of the National Academy of Medicine, Dr. Victor J. Dzau, joining us from Durham, North Carolina. Dr. Dzau, thanks so much for taking the time to be with us today.
Thank you, Sam. I look forward to having a talk with you.
So the U.S. healthcare sector contributes more to global warming than any other wealthy country's healthcare sector. You've laid out some goals for the U.S. healthcare industry to reduce that carbon footprint. But as we all know, the U.S. healthcare sector is not exactly known for being able to turn on a dime. It's obviously a lot of disparate entities with disparate interests. So how do you convince all of those different entities, not just that this is important, because I think a lot of people recognize that, but that it's so important that it may even be worth, spending some money on, making a real investment, even if your competitors aren't?
Yeah, so thank you very much, Sam. I think it's a really critically important question because, believe it or not, the U.S. health sector contributes 8.5%, as much as even up to 10% of carbon emission in the United States. That's a huge number. And as a system that cares for patients, certainly we should not contribute to climate change and the negative health effects of climate change. So consequently, there's really a great agreement, if you will. People are highly motivated to say, let's do something about this. And I think, as you said, our system is highly fragmented. To begin with, if you look at care delivery, we have the government hospitals, we have private hospitals, we have different insurance, so that we don't have a unified single-payer system, a national health system, as the United Kingdom. Then, of course, we have the private sector. After all, the majority of carbon emission comes from supply chain, pharmaceuticals, device, and others. So to do this is not an easy task. However, we feel at the National Academy of Medicine, being the conveners we are, and being the neutral, independent entity, we've been able to bring all the players together, the major stakeholders, the CEOs of health systems, the practitioners, doctors, nurses, the educators, and importantly, the private sector, supply chain, biotechnology, device CEOs, to come together under the umbrella of a collaborative that we've initiated. The idea is the coalition of the willing, if you will. But the good news is everybody wants to do something about this, and they need somebody to organize this. Then, of course, we're working closely with the U.S. administration, Biden administration, particularly Assistant Secretary Rachel Levine, and the new Center for Health Equity in HHS. And in working this as a public-private partnership, bringing the government, the private industry, the healthcare delivery system together, we are beginning to set goals together. First, we begin with measuring what we need to measure, so that we know how much, in fact, every entity is contributing, if you will, in greenhouse gas emission. And then we're going to set goals together to meet, at least towards, if not meeting, the goals set by President Biden for 2030 and 2050.
And just to sort of contextualize that effort somewhat, we know that many of the effects of climate change are or will be health effects, but it's not necessarily front of mind, I think, when in the broader political discourse around that issue. Why is that?
Well, I think people see climate as something's happening to our planet and more in the future. Frequently, you hear people talking about future generations. And then you see pictures of a polar bear on a small slab of ice. I think this is a public health crisis. If you look at what it's doing to our health globally and to our nation, it's really substantial. For example, there are 2 million plus deaths globally in climate-related events and factors. And of course, you look at air pollution, 7 million globally. I think somewhere around 700,000 of deaths in our country related to this. These are public health crises. And what we want to do as a community, as a professional in biomedical sciences and healthcare, is to sound the alarm for people to know we need to act now. And it's not acting for the future, but in fact for our health right now.
And what are some of the practical steps you think the industry can take here to look inward at its own carbon footprint? I mean, if you are a hospital or even a big manufacturing facility, you can't necessarily control something like
Right.
whether renewable energy powers the electrical grid that you connect to.
Yeah, so I think, first of all, the health and medicine community need to come together and to act together. I wrote a paper in New England Journal of Medicine, Call to Action, along with Secretary Levine, as well as my co-chairs of the collaborative, Sir Andrew Whitty and Mr. George Barrett. And we really call to action that we all need to work together towards decarbonizing the health sector and also making our system more resilient. Now, in that context, I think what we're really talking about is look at how we practice. How can we change things? So let's think about this. In the care delivery, all the facilities in healthcare are big consumers of energy, 24/7, right? HVAC, electricity, you name it. But I think a lot of them is related also to the way we deliver care. There's, as we all know, 30% waste. There's a lot of waste. Therefore, we can reduce the waste. But also importantly, we can improve efficiency. If you look at the way that we do care, we use big machines and expensive diagnostic looking at treating disease. We need to move towards prevention. And during COVID, where there's a shift towards, say, digital technology, telemedicine, we have substantially reduced the need for people to come to hospital, transportation, which of course generates carbon, right? As well as many other testing, etc., but do it remotely. So I think we know that there are ways which you can actually greatly reduce carbon emission. Anesthesia gases, a big source of carbon emission. More intravenous anesthesia can be used. So I think changing the practice of healthcare is a critical issue. And that's all good because if you think about where we want to be more preventive, want to be closer to the community, want people to be actually, cared at their home and their community. And so we can start changing the way we deliver healthcare. On the other side, healthcare also buys lots of products and the supply chain emits huge amount of carbon and greenhouse emissions. So supply chain, such as transportation, packaging, manufacturing, can all change. So the whole collaborative that the National Academy of Medicine put together, which is a public-private partnership, is to say, let's look at our practices. Let's begin to measure. Let's now think about how to innovate and how to get systematic changes to reduce overall the emission of carbon in our health sector.
And I gather that's sort of one, getting the healthcare industry to think about climate as a public health crisis, as you said. I assume that sort of feeds into getting the public and policymakers to think about it in the same terms.
Yeah, I think this is so important. And I think we as a community get it. We just need to mobilize and being able to really practice, so to speak, walk the talk, if you will. And so that's what we're working on right now. I would imagine that as we look forward, the U.S. administration is going to ask that for institutions which are, say, government institutions, or those who receive government support, they could put some goals and mandates. However, as I said, many of the part of industry are not under that umbrella. And what we are doing is to bring people together, to set goals together, to act together, so that we can achieve these goals that we all set out to achieve.
All right. Fair enough. Well, that's an ambitious task. A lot to cover here in 10 minutes, but that is our time. So, Dr. Dzau, thank you so much for taking the time to be with us today. Really great to speak with you.
Thank you very much, Sam. This is a critically important topic. As healthcare providers and health system, we take this very seriously. We recognize we need to do well by our patients, by the public, and prevention. We need to do everything, including really in many ways mitigating and reducing carbon footprint.
All right. Thank you so much.
Thank you.
And now I'll turn things over to my colleague, Axios' Chief Business Officer, Fabrizio Drummond, for a View from the Top segment.
Hi, I'm Fabrizio Drummond, Axios Chief Business Officer. Thank you for our sponsor, HTA, for making this conversation possible. I now have the pleasure of hosting a conversation with Chip Davis, President and CEO of HTA. Chip, welcome to Axios.
Thanks, Fabrizio. It's a pleasure to be with you.
Thanks for joining us. Supply chains globally have been impacted by extreme weather caused by climate change and will continue to be impacted. What role do healthcare distributors play?
Sure, it's a great question. Just by way of background, the Healthcare Distribution Alliance is an association that is made up of primarily healthcare and pharmaceutical distribution companies. Some very large companies, Fortune 20 companies that you may have heard of, the likes of McKesson, Amerisource, or Cardinal. But we also represent full-line distributors that may have only 20 to 25 full-time employees in areas throughout the United States, often focused in rural and underserved communities. And the one thing that they all have in common is that they are vitally important in ensuring that they can deliver medical products, medical supplies, innovative and generic medicines to the frontline providers on a daily basis. As you point out, we're seeing a significant increase in the number of weather-related events attributed to climate change, whether it's an increase in the number of hurricanes or tornadoes, certainly wildfires and the like, are things that have a tremendous impact in those regions of the country that where those events are taking place. And what's critically important from our role in connecting manufacturers on the front end, our 35 full members connect over 1,400 manufacturers, Fabrizio, to over 180,000 healthcare providers, literally on a daily basis, is to make sure that as a geographically dispersed industry across the country, that we are prepared in advance to make sure that healthcare services, medicines, medical products, and other critical aspects of care are available in advance of when these natural disasters are impacting regions of the country. So our members have a lot of experience in that area. And unfortunately, as we see an uptick in the number of weather-related events attributed to climate change, that's certainly unfortunate, but fortunately, we have a level of expertise in our industry that allows for us to combat that as best as possible and be prepared to address it.
The healthcare sector makes up about 10% of the U.S. Greenhouse gas emission. What are you doing to decarbonize supply chain within healthcare?
I guess I would answer that in two ways, Fabrizio. One is, to address it as a total sector, and then one, a reflection on what some of our companies are doing individually. First, as a sector, as you referenced, 10% is a significant number. If you think about the healthcare industry overall, it's about 20% of GDP. So it is actually consuming a significant amount of resources on an annual basis. It's one of the reasons why, as an entire sector, the distribution industry recently joined the action collaborative that is being furthered by the National Academy of Medicine, focused on trying to decarbonize the healthcare sector. This is an initiative, again, led by the Academy of Medicine with the full support of the Biden administration. I'm pleased on behalf of HDA and our members to be co-chairing a work stream related to looking at the supply chain and infrastructure component of the entire U.S. healthcare system. This is a multi-year initiative, and many of our companies are actively involved in providing counsel both directly to the initiative and indirectly through our leadership of it as well. I think the other thing that you see is many companies in the industry that are focused on laying down their own commitments, public-facing commitments to reduce their own carbon footprint. We have a number of our leading members who have talked about setting public goals to, for example, a 50% reduction in their greenhouse gas emissions by 2030. Other members who have publicly stated their commitment is to be carbon neutral by 2050, if not sooner. And then we have a number of members who are making investments in an effort to try and reach those goals, investing in things like renewable packaging and resources, or converting several of their operation or distribution centers to being more reliant on things like solar panels and the like. So there's a significant amount going on a company by company basis, as you might imagine. And even more so, I think it's a reflection of HDA and its full members that we've committed to support the important work that the Academy of Medicine will be furthering over the next several years.
In April, President Biden announced new targets for the U.S. To achieve a 50 to 52% reduction to 2005 levels in greenhouse gas pollution by 2030. What else are HDA member companies doing within their own operations to support on those targets?
Yeah, I would answer that, Fabricio, in two ways. I think one is sort of the public-facing commitments that I referenced previously in making sure that in looking at how they go about their operations, it is literally an industry that has been built upon a relentless focus on driving efficiencies in how they help control costs overall. And I think as you look systemically at how any one of our individual distributor members is running their business, they're always looking as ways to maximize the value of the services they bring and minimize the cost. So you're also seeing, in addition to those commitments to reduce the carbon footprint, significant investments that are being made. As an example, one of our leading members has invested millions and millions of dollars to convert the energy use primarily in one of their largest distribution centers to solar power driven energy. We have other members who are looking at piloting the use of electronic trucks and vehicles to make sure that they're moving products from the manufacturers to the frontline providers. You have other members who are looking at renewables in terms of how medicine and medical supplies are packaged, and how you can use reusable packaging to make sure that, again, on a small step-by-step basis, incremental, ultimately, if more and more members are getting behind those types of practices, you're going to see that ultimate commensurate reduction in the footprint that everybody is increasingly committing to.
Well, maybe one last closing thought. From your perspective, what does the future of the healthcare supply chain look like, and how does climate change mitigation fit into that vision?
Yeah, again, sort of two reactions to that. I think, as we all know, issues around the overarching supply chain, not limited to medical supplies, which often didn't get a lot of attention and focus prior to the pandemic, are now sort of kitchen table issues, if you will. The medical supply chain, I would submit to you, has been incredibly resilient throughout the course of COVID-19. And there's a lot of lessons and best practices, I think, that can be seen in the medical supply chain that could apply to the broader economic supply chain to potentially minimize some of the recent disruptions that we have seen. How that impacts the issues related to climate change is, I will tell you that, again, all of our members, from our largest to the smallest, are focused in this area. One of the things that they have all, in discussions that we have had with them, recognized is that this is a great issue of importance, not just to the federal government, state and local governments, but to their employee bases, to prospective employees. You have employees coming in the door that are interviewing with companies and asking what the company's strategy is to reduce their carbon footprint and their commitment to addressing issues related to climate change. You have significant third-party stakeholders, whether they be business partners or, as I said before, government agencies, that are going to increasingly put upon the entire healthcare supply chain, including our members, some degree of standards or expectations. And you also have, for those publicly traded companies, institutional shareholders that are increasingly socially conscious and that are asking for companies to develop their own strategies and be able to come back and report to that on a regular basis, certainly annually, if not quarterly. So I think it's going to be a cornerstone of the strategies that all of our members have moving forward.
Excellent, Chip. Thank you for joining us and for such an insightful conversation.
Sure. Fabricio, thank you. It was good to be with you.
Thank you. Thank you, HTA, for making this conversation possible. Now over to our next segment.
Thanks, Fabricio. I'm Tina Reed, healthcare editor for Axios. And our final guest today is the representative from Illinois' 14th Congressional District, Representative Lauren Underwood, joining us from Naperville, Illinois. Welcome, Representative.
Hi, Tina.
Obviously, we're here today to talk about climate change. This is something that has been top of mind most recently with those terrible tornadoes that ripped across the U.S. this week. I guess I wanted to start by asking, do you think the conversation is starting to change when we talk about climate change?
I think the conversation has absolutely changed, particularly as more and more Americans and certainly policymakers acknowledge the clear linkage between climate change and healthcare impact. And so when we talk about the need for bold action, I think a lot of people share my sense of urgency.
Can you talk a little bit more about what that link is between climate change and healthcare? Because they're not often directly linked together when we talk about them.
Well, we know that there is certainly a link between food security and climate change, and obviously access to nutritious foods impacts our health and well-being. But there's also a growing body of literature documenting the impact of air pollution and extreme heat, for example, on climate change, on health, and those are two climate change-related impacts. And then obviously we've seen a rise in extreme weather events, the tornadoes, as you mentioned, wildfires, hurricanes, which all have impacts on both our individual health and our public healthcare system. And then finally, the emergence and continued emergence of new infectious diseases, many of which are vector-borne or spread by different birds or insects or things like that, which obviously also have a climate change impact. And so when we think about climate change and the way that it's impacting our lives, it's not just economic, it's not just in our immediate environment, but it's certainly impacting our individual health and our public healthcare system.
And one of your passion subjects has certainly been maternal health. Can you talk about the specific link between maternal and child health and climate change?
So in the summer of 2020, there was a really important study that was published in the Journal of the American Medical Association describing that link between extreme weather events, specifically extreme heat and air pollution, on maternal and infant health outcomes. And so I saw that, my team saw it, and we immediately knew that we needed to add a bill to our Black Maternal Health Momnibus Act, which was a comprehensive solution that we've introduced in the Congress to end our nation's maternal mortality crisis, because we know that patients, providers, and communities need additional resources to be able to combat these healthcare and maternal and infant health impacts of climate change.
Is that the Protecting Moms and Babies Against Climate Change Act?
That's right. And I'm so pleased to be able to work with Senator Ed Markey on this important legislation. There's grant programs in there, including $85 million, which has been included in the Buildback Better Act that we passed out of the House of Representatives that the Senate is currently considering.
Okay. Is there other legislation that you're also trying to work on to address this issue of climate change and health?
Well, more broadly, we know that there is one agency in the federal government that is dedicated to addressing the public health impacts on climate change, which is the Climate and Health Protection Program down at the Centers for Disease Control and Prevention in Atlanta. And during the Trump administration, that critical office was really being undermined by the Trump administration, who sought to fire all their staff and reorg the office to really just try to eliminate that important work that they were doing as a resource for America's communities and being able to prepare and respond to climate change in the way that it's impacting their residents. So what I've introduced is the Climate and Health Protection Act, which would authorize over $100 million to go out to municipalities and counties and states across the country to help them prevent, prepare for, and really respond to these climate change related impacts on their populations.
What can you say about the status of that or the chances of that moving ahead?
Well, we're really pleased that in the fiscal year 22 appropriations bill that the House passed, that is fully funded. And so this is part of the reason why I am so enthusiastically urging our Senate colleagues to complete their work as quickly as possible on the 12 appropriations bills to fund the government. As you know, Tina, we are in the middle of another continuing resolution until mid-February, but it's my hope at that time that we'll be able to pass an omnibus bill, which would allow this type of critical funding to be put in place to help every community across our country address these public health impacts of climate change.
How do you think the industry should be responding when we talk about climate resiliency in our infrastructure?
Well, we know that there's certainly a role for industry when we talk about mitigation, resiliency, and sustainability. We also know that there's an opportunity to create, thousands of good paying jobs. And that's exactly what we're investing in with the Buildback Better Act. I mean, this is legislation that will boost our economy, create these new jobs in the clean energy sector. These are American jobs, good union jobs that can't be outsourced. And we have the ability to pay for this innovation and investment in our collective resilience by requiring the corporate tax evaders and the wealthiest few to pay their fair share.
Well, I guess when I think about some of these major weather events like hurricanes and wildfires, it's often healthcare that you hear about being impacted directly, even having to evacuate to protect patients and or make sure that they've got proper electricity systems up on board so that they have continuity of service. I guess, do we need more investment?
Oh, absolutely. And so, we've seen so many communities really understand the linkages between having a strong resilience grid and, their ability to support their older residents, those senior citizens who, need air conditioning or, heat stroke is a real phenomenon in extreme weather events where we have incredible heat, for example. We have seen the data has been very clear that, for example, if your community knows that they're in the path of a storm or in the path of a wildfire, right? The Department of Health and Human Services during the Obama administration was leading the effort and the work to make sure that, for example, patients with kidney failure were going in for early dialysis, right? To prevent those types of deaths. And so, I think that we have a really rich evidence base in the literature. The key is getting that incorporated into our policies and procedures at the institution, health systems level, and making sure that support is there with our federal policies and reimbursement structures to make sure that all patients have access to the health care that they need in the aftermath of these weather-related disasters, which we know put a lot of strain on a healthcare system in a community that's been, in the midst of a storm or other climate-related event. And so we've been working on that, I would say, in Congress, and certainly I know the executive branch has as well.
And how do you think the healthcare system as a whole should consider and address its own environmental impact?
Well, the healthcare system certainly has a responsibility to assess and acknowledge the threats impacting the communities that they serve. And so while we, I think, talk about climate change as this existential threat that, we can all have our personal philosophies and approach to policymaking, I think that at a really tactical level, it's the responsibility of healthcare systems to be encouraging their providers to have these conversations with their individual patients, make sure that those patients understand the specific climate change related risks that are associated with the comorbidities that they may be presenting with, right? If someone has a chronic illness and there's a weather emergency, their plans may be disrupted. Their ability to get their life-saving medication may be disrupted, and that patient and family should have an understanding of what they'll be able to do to maintain that kind of clinical continuity. And so I really believe that we're going to continue to see healthcare systems really driving these conversations, particularly in those communities where there may be a political reluctance because of the partisan leaning of the elected leaders.
And how do you see climate equity and health inextricably linked?
Well, we know that because of the way that climate change impacts communities, that it's often those without resources that are most acutely impacted. Climate change impacts everybody, but those who face, the most devastating economic consequences are often those who, walk in with the fewest number of resources. This has been very well documented in the environmental justice literature, and it's really been exacerbated by longstanding policies like residential segregation and redlining, and people whose homes are in the shadows of industrial pollutants, for example, like those factories or whatever that are, really polluting the atmosphere. And so I think that we are just beginning to get into detail around this equity conversation when it comes to preparing communities for the public health impacts on climate change. But I think that the key is making sure that the resources go directly to those communities and that we are not putting up artificial barriers for those communities to be able to take action right now.
Well, Representative Underwood, thank you very much for joining us today.
Thank you very much.
Thank you all for joining us this afternoon for another virtual conversation that has made everyone smarter, faster. For more information or to sign up for the Axios Vitals newsletter, visit axios.com/newsletters or visit the Axios app. Thank you all for joining, and we'll see you next time on axios.com.